Thank you for being with us today. If you could please tell us and explain to our audience what is the health account system of Dubai and why does the DHA do it?
Good morning. Thank you so much for having me. To start with, HASD, which stands for Health Account System of Dubai, is a system that DHA is very proud of. Through this system, we're able to monitor health expenditure throughout the years. And on top of that, we're able to assess the impact this health expenditure has. And what we're showcasing here is the impact on the health insurance in Dubai.
Can you explain to our audience what are some of the benefits when you track the health accounts? What are the benefits for the health sector, for the emirate, and for the population?
Absolutely. So when I say we assess the impact is we want to know that the current policies are actually providing benefit to the society of Dubai. For example, we looked at the out-of-pocket spending, so the personal spending from the families. And we have noticed that over the years, personal spending used to be at 25%, and this has decreased significantly to 13% as of 2023, which is a great achievement stemming mainly from the mandatory health insurance that has been put in place at the beginning of 2014. Which gives flexibility for families to utilize a lot of these funds for their own personal requirements and uses.
If you could explain to us, why have we seen such a big benefit? Is it purely because of health insurance? And if yes, how has that facilitated to such a big difference, such a huge improvement?
So yes, we have seen a lot of benefit, as I mentioned, that families can actually utilize these funds that were previously spent from their own pockets towards their own health requirements or health needs. What happens is now, majority of the health expenditure, 48% in fact, is covered by the private sector, so being the employers themselves. And comes next is the government, and finally, at a smaller percentage, is coming from the sort of your own pockets, basically. This is a great testament in the trust that the private sector has into the economy of Dubai. 48%. It's a great example of, sort of the cooperation that we have from the private sector and their trust in the economy as well. Majority of this expenditure, I would like to note, goes into curative services. So around 57% of that goes into curative services, meaning people only go to the hospitals really to get cured. And we would like to see more people getting preventive services in order not to reach to the stage of having to be cured.
Correct. So now this shows me that the data you all are using is going to help you all to devise a lot of policies.
Exactly.
For preventive care, so on and so forth. So when you look at all your data, this is a two-part question.
Yes.
If you could tell us the 3 or 4 top line numbers, and then if you could tell us how is this data helping you with your future policies and plans? What are some of the 3 or 4 trends that you are going to pick from this data and go
Yes.
with?
First important outcome, I would say, is the out-of-pocket or the personal expenditure reaching 13% or decreasing to 13%. This is significant, and it's one of the lowest in the world, I would say, which is great. The contribution of health industry into the overall national GDP, Dubai national GDP, has increased from around 3% to 5.2%, again, showing that the health sector is growing and helping to grow the Dubai economy. And thirdly, that we've got 48% of this insurance coverage is coming from the private sector. Now, some of the things that the data have identified is that we've got a scope to increase utilization on preventive care. And this is where we're working now at the moment in putting in place initiatives to see where should we focus the prevention in order to make sure that people live longer, happier life in the future.
Thank you very much for speaking to MedEdge today.